Good morning, this is Dr. Aneek Saha. I am here to clarify a few queries regarding depression. So, depression is a mental health disorder which is characterized by, which is classified as among the mood disorders, which is characterized by low mood, decreased interest in daily activities, increased fatigue, decreased energy, decreased sleep, decreased appetite, which spans for more than or at least 2 weeks. How depression is different from normal sadness? There are two words, two P's differentiate depression from normal sadness. Two P's are persistence and pervasiveness. When persistent and pervasive sadness for at least 2 weeks can be called depression. Yeah, depression can affect pretty much anyone. It can affect both the genders, it can affect children, it can affect adults, it can also affect the elderly. So yes, depression can affect anyone. About the risk factors, there are many risk factors, but if I have to basically talk about the major risk factors, first one should be the family history and genetics. Now, a person who has a close relative, like the parents or sibling who has depression, is more probable to have depression than somebody who doesn't. Then chronic stress, pervasive stress in work, in relationships and everything leads to depression much easier. Then history of trauma, particularly history of trauma in childhood, leads to depression. Then gender is also a risk factor because women are more liable to be depressive than men. Then poor nutrition, like people who have more processed food and less whole or organic foods are more liable to have depression. People who consume foods low in all the different kinds of vitamins, and then the certain minerals like zinc, magnesium and manganese have a higher propensity to have depression than people. Then there are other risk factors like unresolved grief. Now, grief is a very normal process is an emotional process for any person. But when it is unresolved or when it is pathological, that leads to depression. People with certain personality traits, like people who are more impulsive, people who are less sociable to other people, people who are more insecure and less confident, these people are more prone to depression. Then people who engage in substance abuse, people who have like things like marijuana, things like other kinds of substances like alcohol, they are more prone to mood disorders in general, not just depression. And certain medications, like for example digoxin is one of them. These are medications which when people take them for a long time, they are more prone to have depression. Everybody with depression needs treatment. If it is clinical depression, the person needs treatment in some kind of modality. Basically, treatment for depression can be divided into two options. One is pharmacotherapy, which is the mainstay, that is treatment with drugs. That is the mainstay of treatment of any mood disorder. The next is psychotherapy. Psychotherapy can be of many kinds, like counseling, like cognitive therapy or behavioral therapy or cognitive behavioral therapy. And then there are other modes of psychotherapy as well. So yes, these are the two basic modalities for depression treatment. If a person thinks he or she is depressed, first thing is to convey to others, to seek help, not to keep it within themselves. First thing I would say is to accept that I can have the possibility that I can have these things. And the second thing is to convey to other people, and then the rest will happen. You ultimately have to take professional help. If we can approach it directly, which can happen in mild depression, well and good. But you have to convey this to other people. Helping people deal with depression itself is a very complex thing. First thing is, I would say, if you know somebody who has depression, first is you encourage treatment. You encourage treatment because you know that you cannot help that person alone. You have to encourage treatment. You have to raise awareness about it to the person and among the caregivers of that person. That is the first thing. Second is you have to be a good listener. Compassionate listening is the need of the hour. You have to talk to the person. You have to say that, okay, I may not help you, but at least I will try to understand. Don't use phrases like, okay, snap out of it. You can be strong, be brave, focus on the positives. This will pass. Don't say these things. That I would say is the second. Then third is you help that person with his daily task, because for a person who has depression, every day is a struggle, every day is like going to war. So when you help that person in his or her daily task or daily routine or regimen, that helps the person a lot to come out of it. And definitely then the other things should follow. Then very important thing is to recognize a crisis. Depression is very much linked to the possibility that the person will try or commit suicide. Recognize the triggers. Recognize if there is anything, you have to seek help immediately. Whether it is law enforcement, clinical help is a mandatory. But even if law enforcement is required, you need to pursue that. Then the last step, and last but not the least, I would say, is to take care of yourself, because these things can be like taking care of a person. If knowing people, if you are, or God forbid, you are a caregiver of that depressive patient, taking care of yourself is also very, very important.